Hello, my name is Emily. I'm going to be the nurse caring for you today. I just need to perform a physical assessment. Is that okay with you?
Yes.
Okay. First, I need your full name and date of birth.
Kelly Salaga, 6/26/66.
Okay, perfect. And can you tell me today's date?
August 2nd, 2021.
Okay. And can you tell me where we are right now?
Doctor's office.
Okay. And can you tell me why you're here today?
I just wanted a complete physical and address some issues I've had going on.
Okay. So first, I just want to let you know that before I start, that you're going to be lying and sitting down for most of the exam, and that none of the tests are unpleasant. Okay. Okay. So basically, before the exam, we went over your vitals, and everything looked good. It was all within range. Your heart rate was 88, BP was 110/72, and your respiratory rate was 18. Temperature was 98.1, and you had a pain scale of 5 out of 10.
Okay.
Okay. And then your weight was 125. Weight was 125 pounds.
Mm-hmm.
Your height was 66 inches, and visual acuity was perfect vision. You had 20/20 vision. Okay. All right, perfect. So now we're gonna start by going through the head to toe assessment.
Okay.
First, I'm just gonna start by looking at your face for any droopiness, any involuntary movements, or anything like that. I see that there's no flushing. The skin looks nice and pink. Okay.
Mm-hmm.
So now I'm just gonna start by asking you to do several facial expressions. I'm gonna assess your facial nerve 7. Okay.
Okay.
Okay, so I need you to raise your eyebrows for me and close your eyes tightly and open them up. And can you smile for me, frown, and puff out your cheeks? Okay, perfect. You did everything with ease, so that means your facial nerve is intact, okay? Now I'm just gonna go and I'm gonna head and I'm gonna don my gloves and I'm gonna be looking through your head for just any masses, any indentations, skin breakdown, or any infestations, okay?
Okay.
Don't feel any masses or anything like that. Okay. Everything looks good, no infestations or anything. Okay. Alright, so everything looks good. I don't see any abnormalities or anything like that. I'm going to doff my gloves. I'm going to perform hand hygiene really quick. Okay. And now I'm just going to start by palpating your face. You're going to tell me if you feel any tenderness or pain, okay?
Okay.
Any pain or anything like that?
No.
No? Okay. So now I'm just going to go ahead. I'm going to basically ask you to bite down, okay, and clench your teeth. Feeling for the masseter muscle. It's going to be a nice little round ball, and it is. I'm going to go up here, continue to bite down. I'm going to feel for your temporal muscle, okay, and it's right there, nice and hard, and you can stop, relax, and I'm just going to be palpating your temporal artery bilaterally, okay?
Mm-hmm.
Okay, and it's 2+ and equal on both sides, okay? Now I just need you to open and close your mouth, and I'm gonna now palpate over your temporomandibular joint. Feeling for any grating or clicking, and I do feel clicking. So can you tell me how long you've had this problem?
About 20 years.
Okay. And does it feel pain or tenderness when I put pressure?
Not really.
No? Okay. And have you been grinding your teeth ever at
Sometimes.
night? Okay. All right. So now I'm gonna move on to your eyes. I'm just looking for any lesions or any swelling of the eyelids, okay? I'm just looking at the pupils, your iris, make sure it's equal on both sides, and they are. Your pupils are nice and round. And I'm just gonna be looking at the sclera to make sure it's nice and white. Little redness and yellowing, okay? And I'm gonna pull down your lower eyelids for your conjunctiva, okay? And it looks nice and pink, so that's good, okay? So now I'm gonna move on to assessing your cranial nerve 2. I'm gonna be doing visual confrontation, or visual fields to confrontation. Okay, so I'm just gonna have you cover one eye. I'm gonna cover the same eye, and I'm just gonna actually just put fingers up, and you keep looking at me, and you tell me how many fingers I'm pulling up, okay?
2, 1, 1, 2.
It's okay. I cover the other eye.
1, 2, 2, 1.
All right, perfect. Thank you. Now I'm going to be assessing cranial nerves 3, 4, and 6, okay?
Mm-hmm.
So what I'm going to be doing is performing 6 fields of cardinal positions of gaze, okay? So what I'm just going to have you do, you're going to follow my pen. Don't stop looking at my pen, okay?
Mm-hmm.
Okay. And I was looking just for any involuntary shakiness of the eyes. I did notice a little bit of nystagmus. That's what that is, okay?
Okay.
So now I'm just going to move on by assessing Perla. And basically, I'm just going to shine one light into one eye. I'm going to be assessing for the pupil to constrict, okay? So you just keep looking at me. Okay, that was good. Do the other one. Okay, good. They both constricted, okay? So that's good. That means that they're equal, they're round, reactive to light and accommodation, okay? All right, perfect. So now I'm gonna move on. I'm gonna be assessing your ears, okay? What I'm doing is I'm just looking at the external auricles for any redness, swelling, anything like that. I'm gonna look at the other one. Okay, looks good. And now you just tell me if you feel any pain or tenderness when I press on them. No?
No.
What about on your tragus?
No.
No? Okay, now I'm just gonna perform a whispered voice test. You can stand right there. And I'm gonna go behind you. You're gonna cover one side of your ear. I'm gonna assess the opposite side. I'm just gonna be whispering a series of letters and numbers. You just repeat them back to me, okay?
Okay.
HM3.
HM3.
Okay, perfect. And you can cover the other ear. Okay. 2J7.
2J7.
Perfect. Okay, so your hearing is intact. Everything's good. If I had an otoscope or an ophthalmoscope, if I was looking in the ear with the otoscope, I would just look for your tympanic membranes to be nice and normal, no redness, pearly gray. And if I had an ophthalmoscope, I would just look at your retina and any abnormalities with your red reflex, okay?
Okay.
So now I'm gonna move on to your nose. I'm just looking at everything to be symmetrical, no deviated septum. And then I'm going to test your patency of your nostrils, okay? So I'm gonna include one. I'm gonna make sure I breathe in and out. Perfect. All right, perfect. Now I'm just gonna take my pen light and you're gonna have your head straight up. Just gonna be looking in your nose for your nasal mucosa, for your turbinates and your septum, okay? Everything looks good, no redness or swelling. Now I'm gonna move on to your mouth and your throat. And I'm gonna take my pen light again. Open your mouth real big for me. Okay, perfect. And I'm just gonna actually ask one more time. Okay, nothing that looks abnormal or anything like that. Your uvula and soft palate did move midline and symmetrically with phonation, so that's good. Okay. And now I'm just gonna have you stick out your tongue one more time. Okay? And you're gonna move it side to side. Okay, so you did that with ease, so that means your cranial nerve 12 is intact.
Okay, good.
Okay, and then I'm just gonna have you do one thing, okay? You're just gonna raise your head. I need you to swallow for me. I'm just looking for the upward movement of your hyoid and your thyroid cartilage. Okay, and it was a little bit of a difficulty, but I did see it, okay? Okay, so now what I'm gonna do is I'm gonna have you move your head to the left, okay? I'm just gonna be looking for the jugular venous pulse. See if there's any increased pressure, and I don't see any, okay? So that's good. Now I'm gonna move on by palpating. You just tell me if you feel any pain or tenderness.
No.
Okay, I'm just gonna make sure that you lift your head up a little bit. The trachea is nice and midline, okay? So now I'm gonna give you this water. And you're gonna take sips on that. I'm gonna posteriorly palpate your thyroid gland, okay? Okay, perfect, thank you. Did you feel any tenderness or
No.
pain while I pressed it? I did notice a little bit of swelling. Have you ever had any thyroid problems?
Yeah, I have some nodules.
Okay, and have you ever noticed any skin changes at all?
Some dryness.
Okay, and what about any intolerance to heat or cold?
Heat.
Okay, any weight loss or weight gain?
Weight loss.
Okay, all right. So now I'm just gonna move on to your heart, okay? So I'm just gonna ask you a couple more questions before we start. Have you ever noticed any fluttering or racing in your chest?
Not really.
No. Are you normally physically active at all?
No, that much.
No. Any swelling in your ankles or feet?
No.
No? Okay. So I'm probably just gonna have you come up and sit up here first so I can get a good assessment on your heart. Okay. All right. So first I'm just gonna be looking at the precordium. I'm looking to make sure that there's no obvious pulsations, heaves, or lifts. Okay, and I don't see any. Okay. And now I'm gonna move on to palpation. I'm just palpating your precordium. Go down to the sternum right in here. Just gonna lift this up. And I'm gonna locate the apex, which is the end of your heart, and it's at the 5th intercostal space, left mid-clavicular line, okay? Okay. And I feel a nice 2+ equal pulse, okay? So now I'm just gonna have you lie down really quick. I'm just gonna percuss your heart quarters. And I'm just gonna assess the size of your heart, okay? So I'm just gonna press, you can have your arm out a little bit, thank you. Okay, note some dullness right here. Okay, right there. And right around here, so it should be right here. So that's where it's located, and that's around the sides, where it's right around there, okay? Okay, perfect. You can just sit up for me really quick. Okay. And now I'm gonna end the heart assessment with auscultation, okay? So I'm just gonna be listening to all 5 areas, okay? So I'm just gonna clean my stethoscope really quick. And I'm gonna start with the diaphragm so I can hear the higher heart sounds, and then end with the bell of the stethoscope so I can hear the lower pitch sounds, okay? Okay, everything sounds good. I'm just gonna do the apical pulse. All right, perfect, thank you. I didn't notice any abnormal sounds or anything that could indicate a murmur, okay? Okay. So now I'm just gonna move on to your lungs and your chest. I'm basically just gonna ask you a couple more questions before we start. Do you ever feel any shortness of breath?
No.
No? What about any tightness in your chest or anything like that? Do you smoke cigarettes at all?
About half pack.
A day? Okay, all right. So now I'm just gonna start off by inspecting the muscles and basically your shoulders just to make sure they align with each other, okay? And they do, everything looks good, and then I'm gonna start with palpating first. So I'm just gonna now palpate over the lung area. I'm just gonna basically be looking for your lung expansion symmetrically on both sides, okay? So first I'm gonna start with your interior chest. Just take a deep breath in for me. Okay, good. I'm gonna do the posterior. All right, perfect. Good lung expansion on both sides, okay? So now what I'm gonna do is I'm basically just gonna have both of my hands in the middle of your chest and then middle to your scapula. I'm gonna have you repeat 99 to me, okay?
99.
Okay. Just assessing for vibrations for a tactile firmness.
99.
All right, good tactile firmness, perfect. Okay. So last thing I'm gonna do is, next thing I'm gonna do is I'm just gonna percuss. So you can just sit there. I'm just gonna percuss over your lung fields, okay? So you can just stay right there. All right, now I'm gonna do the posterior chest. One more side. Okay. Perfect. Okay. So I heard good resonance over the lung fields. Now I'm going to end it with auscultating over your lung fields, and your upper and lower lungs. Just going to compare the sides, okay?
Okay.
You just take deep breaths for me while I do it. Okay, good. And do the other side. Okay, perfect. Okay. Great. Couple more. Okay, perfect, thank you. And I didn't notice any adventitious sounds, so that's good, it's normal. Okay, so now we're just gonna move on to your abdomen. So what I'm gonna do is ask you a couple more questions. Do you take any dietary supplements or anything like that?
Daily vitamin and some
Okay. And you said you did have, you know, some thyroid problems. Have you ever had any difficulty swallowing or anything? Yes. Okay. And you ever noticed any appetite changes?
Not really.
No? Okay. So what I'm going to have you do now for the abdomen, I'm just going to have you lie down one more time. You get a good clear view of your abdomen. Okay, and now I'm just going to be inspecting first. I'm looking for the contour of the abdomen, sure it's nice and evenly rounded, and it is. And then I'm going to move on, just basically look for any skin characteristics that are abnormal, any lesions, hernias, any striae. And then your umbilicus is inverted, so that's normal, it's good. And the hair distribution is normal. I don't see any ecchymosis or anything like that, okay? Now I'm just basically gonna start by auscultating, so we don't wanna palpate, only because we don't wanna disrupt those bowel sounds, okay? So I'm gonna listen first. I'm gonna be listening in your lower and upper quadrants. I'll start down here in your lower quadrant. Okay. Just looking for nice gurgling sounds. Okay, so everything sounds good. We have normal bowel sounds, okay? And now I'm basically just gonna start by percussing your abdomen. So I'm just going to now start over on this side, so you can just relax. Just assessing for any fluid or anything like that. Okay, I'm just gonna come over this side really quick. I'm just gonna percuss over your liver so we can just locate this location and its size really quick. So let's start down here. I definitely noticed some dullness over the liver right around here, so I'm just gonna start from up here. Okay, should end right around here, so that's usually where the borders are, right at the end of your rib cage, okay, so that's normal. All right, now I'm gonna just end your abdomen assessment with palpation. I'm gonna start with light palpation first, okay? I don't wanna cause any pain. You just tell me if you feel any tenderness while I do this.
No.
Looking for any superficial masses, anything like that. Now I'm gonna end with a deep palpation, okay? Looking for any organ enlargement. Tell me if this hurts.
No.
Okay. And I'm just gonna keep my hand right here and I'm just gonna palpate for your kidney and see if there's any tenderness there while I do that. No? Okay, I don't feel any swelling. Okay, just gonna do this side really quick. No? Okay, perfect. Okay, you can sit back up. Now we're just gonna move on to your upper and lower extremities. So first, I'm just gonna start by going through your pulses. I don't wanna miss anything. So first I'm gonna do your carotid pulse, okay? Don't wanna do them simultaneously because you can occlude blood flow to the head. We don't wanna cause any fainting or anything. Okay, and they're both 2+ and equal on both sides. And you can just leave them like that. Palpate over the brachial arteries. We feel nice and equal on both sides, 2+. And do your radial. And 2+ and equal on both sides. Just gonna go through them all really quick. Your popliteal, which is behind the knee, and 2+ and equal. And if you could just lay down really quick so we can just get that out of the way, I'm gonna just do your femoral pulse, okay, just before I forget. Just right in your groin, so I'm just gonna assess it right in here. Okay, and it feels nice and strong, 2+ and equal on both sides. Okay, before you get up, just gonna make sure I palpate those inguinal nodes. Okay, and I don't feel any swelling or anything like that, so that's good. Okay, good. Sit back up. And then before we end, we're just gonna finish those pulses. So I'm gonna come down here. I'm gonna get the posterior tibial, and it's 2+ and equal on both sides. And lastly, your dorsalis pedis. And 2+ and equal, so that's perfect. Everything's equal bilaterally, so now I'm just gonna go over those upper extremities. Palpate your epitrochlear nose. I don't know any swelling or anything like that. Okay, and then we're gonna just do some range of motion exercise, okay? So you can just lift your arm up, Okay, do the other one. If you could circular motions, that way and then the other way. Do the same arm and then the other way. Okay, all right. So now I'm gonna have you just bring out your arms for your elbows, and then you're gonna take them like this and just go up and down. Okay, perfect. And can you rotate your elbows? Can you bend them up and down? Okay, and can you push on my hands? And pull back. Okay, perfect. So now before we move on to the lower, I just wanna do your skin turgor. Make sure you're nice and hydrated. It was a little slow in return, so you might need to consume a little more fluids. Okay, we're gonna do capillary refill. Pressing down the nail bed. And it was good return, it was under 2 seconds, so that's good. Okay, now before we move on, I'm gonna have you do the Fallon's and Tinel's test, okay? So what I'm gonna have you do is do the Fallon's first. You're gonna take your wrist and flex them. Keep them like that for a couple seconds. Tell me if you feel any pain, numbness, or tingling. Okay. Now, what I'm gonna have you do is you're just gonna relax one of your arms, okay? And I'm just gonna now tap over your medial nerve through your carpal tunnel. You tell me if you feel pain, tenderness, numbing, tingling, okay? Anything? No? All right, good. So you don't have carpal tunnel syndrome, so that's good. Now I'm gonna move on to the lower extremities, okay? So first I'm just going to have you do your range of motion exercise, okay? So what I'm gonna have you do is you're gonna bring your leg out as far as you can, each side. Perfect. There you go. And then you're just gonna lift your leg up, both legs. Try to relax your knee and just do it with your knee, okay? All right, now for this test, I'm just gonna perform a straight leg test really quick. Okay, so I'm just gonna stabilize the knee. I'm gonna dorsiflex the foot a little bit. Does that feel any pain in your lower leg? Nothing? Okay, good. Okay, what about this one? No, nothing? Okay, perfect. There's no tension on your sciatic nerve, so that's good. So now I'm gonna have you just continue to do your range of motion. Can you twist your ankles for me? Okay, other one. And I'm gonna have you press down like a pedal and then pull up. All right, perfect. Okay, so now I'm gonna have you do the neurologic exam, okay? So you can actually get up for this one and sit back down because you're gonna have to stand up for the muscles.
Okay.
Okay. So you can sit down really quick, okay? But first I'm just gonna have you, gonna be testing for sensations, okay? Your face, arms, hands, legs, and feet. Okay. You're gonna tell me if you feel this on both sides and similar, okay? Similar sensation, you tell me, okay?
Yes.
Okay. So I'm gonna pull up your pants really quick. Feel that?
Yes.
Okay, perfect. Okay, now I'm just gonna test your position sense of your fingers. You just tell me if you feel it going upward towards you or downward towards me, okay?
Up, down,
Okay, we'll do the other side.
up, down,
Perfect.
up, down, up, down.
All right, perfect. Now I'm just gonna test stereognosis. You can stay right there. I'm just gonna have you identify 3 familiar objects with your eyes closed, okay? You just tell me what they are.
The key,
Yes, perfect. Okay,
it's a coin, quarter,
perfect. And last one.
and that's a cone.
Okay, perfect. Okay. Now I'm just going to trace your hand and test graphesthesia. You're gonna keep your eyes closed. You're gonna tell me what numbers I'm tracing on your hand, okay?
3, 5, 8.
Perfect. Okay. Now I'm going to move on. I'm going to be assessing your cerebral function of your upper and lower extremities. So I'm going to have you do your rapid finger alternating movements, things like that. So finger to nose first, and now do it with your eyes closed. Perfect. And then the rapid alternating movements, just touch your thumb with each finger as fast as you can. Perfect. Okay. Now I'm just gonna have you take one heel and run it along the opposite shin, just like that. Okay, perfect. Okay, so everything's intact. So now we're just gonna move on. I'm basically gonna assess your tendon reflexes, okay? Okay, so you can just stay right there. I'm gonna start with your left side. So you can just relax your arm. You're gonna assess your tricep reflex first. Okay, and now I'm gonna have you just relax your arm across mine. Put my thumb here. This is your bicep reflex. Okay. This is your brachioradialis. I'm gonna assess it right here. You can just relax it just like that. Okay. Okay, good. Do your other arm. Just relax this one. Okay, good. Just a little bit like that. There we go. Okay. And you're gonna leave it like that so I can just relax it. Okay, perfect. Now I'm gonna do your lower extremities. I'm just gonna do your patellar and your Achilles. Okay. Okay, so just relax your legs. You need to move up. Okay. Little hypoactive, that's okay. I'm just gonna stabilize your ankle. We're gonna do your Achilles. Okay, thank you. And now I'm just gonna do the last thing, which is your Babinski reflex, okay? I'm gonna take both feet. Just gonna rub it along. You're gonna looking for any flaring of the toes. Okay, we're gonna do the other one. Okay. Okay, everything looks good. I'm just gonna move on to the last part of the exam, which is your musculoskeletal. I just need you to tell me if you've ever had any musculoskeletal problems, such as stiffness, weakness, pain.
Just in my left knee.
In your left knee, okay. And have you ever taken or currently taking medications or supplements for your muscles or bones?
Just vitamin D and just pain.
Same company, okay, same supplements. All right, perfect. So what I'm gonna have you do first, this is where we're standing up. I'm gonna have you walk in your normal walk. You're gonna turn and you're gonna come back heel to toe fashion. Do this for me really quick. Watch me do it. Heel to toe.
way. Oh, I'm sorry.
That's okay.
I'm so sorry.
Perfect. Perfect. And then you
Okay.
did your heel to toes, which that is exactly what I wanted you to do next. And you're able to do that and ease. Okay, perfect. So now I'm just gonna have you stand right here. I'm gonna have you turn around for me. And I'm gonna have you stand with your feet together, your arms to your side, okay? I'm gonna have my arms out. Keep your eyes open and just stand straight for me, okay? Just assessing your Romberg sign for any postural swing and for you to be able to maintain your balance. You can close your eyes now. Okay, and you were able to maintain your balance, so I didn't notice anything like that, so you have a negative Romberg sign, okay? Okay, so now you can just sit right there again. Basically, I'm just gonna move on now. I'm gonna be assessing your spine. So you can actually stand back up, I'm sorry. You can stand back up and you're gonna act like you're touching your toes. Okay, and I'm just assessing for spinal alignment and position. Okay, and it looks good. Okay, and then I'm going to basically, before we move on, I'm gonna have you hold on to this right here. You're gonna perform a shallow knee bend, like a squat on each leg. Perfect. Perfect, okay. So now the last thing we're gonna do is I'm just gonna have you can actually stand up really quick. I'm so sorry. I'm gonna stabilize your pelvis. You're gonna hyperextend your neck for me. Perfect. Laterally bend to the sides for me, downward. Perfect. And can you rotate just your upper trunk? Okay, perfect. You did everything with ease, so everything looks good. Okay, so that completes the physical assessment. I'm just gonna leave the room really quick and I'll come back. We'll discuss my findings and you can answer, I'll answer any questions you may have, okay? Okay, so all my findings were pretty expected, nothing really out of the usual. We did notice some thyroid issues, there was swelling and things like that. You have difficulty swallowing, so I would just recommend seeing an endocrinologist at some point.
Okay.
You did have tenderness in your knee joint, you said, so I would just recommend seeing an orthopedic and definitely going to your primary about all your chief complaints, okay?
Okay.
Okay. And just one last thing, I noticed the skin turn, so we definitely want to consume more fluids, okay?
Okay.
Okay, thank you so much for your time.
Thank you.
Thank you.